I mean, we went right into our next topic about how soon should ortho-K be considered for myopia control. So let's go to our next one, which is what degree of myopia, diopters, or axial changes progression would be considered medically appropriate to not intervene with some sort of myopia control method and instead utilize traditional vision correction methods such as single vision glasses or contacts. Jonathan, what do you think?
So this is an interesting discussion to have with this group here because I think we are all very much pro doing something for a young myope in order to help them in their future. In terms of progression, we all have a very serious passion and concern for those young myopes and likely progressing myopes. So for me, I'm hard pressed to look at any degree of myopia as safe. I do feel inclined to start intervening personally. As soon as I see the indication of refractive error development, or as Cheryl and Michael were discussing earlier, axial length measurements indicating that change is coming or is here. So I have a hard time not intervening and doing something, just because I figure we have the tools available to us now. It would be doing almost a disservice to not do something. Unless, of course, patient did not see eye to eye with me or the motivation factor wasn't there. So, Cheryl and Michael, what do you guys think about this?
Well, I guess if I, during a normal exam, talk to the patient and know the history, that the parents are nearsighted, that the kid is not nearsighted at this point, but maybe showing some signs of being at risk, the least intervention we do is education. And again, if the child is at a point where they need some kind of vision correction to function in school, then we talk about various options, and I always make a distinction between myopia correction and myopia management. So I don't think there is a age that you start doing that. It's just based on history and based on what you're seeing in that patient, trends that you're seeing and predictions. And I always hand out information to patients. I have it readily available to give them. And this is this myopia story. And if this is what's going to happen to your kid. So.
I agree. I mean, you have these discussions going on about what is standard of care, and is it standard of care to offer myopia management, and I would say we're probably not there yet. It's probably not mainstream enough. However, it's definitely moving in that direction, and at some point in time, it's going to tip to where if an optometrist sees this progressive myopic kid and they're not offering myopia management, or at least having that discussion, now they're going to be not even performing the minimum standard of care. That's, like I said, I don't think that's probably there yet, but as we learn more and as we're educating all of our new doctors on it that are in optometry school, and as all of the CE is out there, it's really important that doctors do take it seriously, that at some point they're not going to be delivering standard of care if they're not at least having that discussion.
Mm-hmm. Yeah, and I feel oftentimes in clinic, I don't know if you guys feel this way, but you don't pretend to have all the answers and to be the fixer of everything, but at the same time you often kind of want to be a leader in thought in the standard of care. So as you said, there may not be enough evidence right now to say, well, of course it's nationally and internationally and worldly recognized as the standard of care, but in some ways I like to be a leader in that and say, okay, this is my standard of care. It's a little higher than what everyone else does, who's not looking at it from this perspective.
And patients appreciate that. And I think a lot of doctors that are hesitant to really incorporate myopia management in their practices, I think sometimes they think cost is a barrier. But I always like to remind myself, and I always like to remind my staff, it's not our job to decide what patients can afford. It's our job to offer them treatments that are available. And if they say, you know what, we just can't do that right now. We really don't want to do anything above and beyond, like, that's on them. at least we can give them the information and they can decide. It's the same thing as other things in optometry that are more specialized care. LipiFlow, for example. Like, I'm going to tell somebody if their meibomian glands aren't good. I'm not going to withhold that information from them. And then it's up to them to decide, are they going to take their fish oil? Are they going to do their warm compresses? Are they going to do their foam lid scrubs? Are they going to say yes to LipiFlow? But I'm going to tell them what I think. I'm going to try and treat these people like we would with my own family members and just be like, dude, this is what you should do. And it's up to them if they follow through, right?
Mm-hmm.